Mike Dennis is the director for Lighthouse Institute, Chestnut Health Systems, and has been the senior psychologist and director for Lighthouse Institute for several years. I'm also joined today here by Ellen Morehouse, who's the executive director of Student Assistance Services Corporation in Tarrytown, New York. Also by Perry Rosen, who is the consulting psychologist for the Pennsylvania Office of Mental Health and Substance Use Services. Additionally, we are joined by Valerie Connolly-Leach, apologies. She is the Behavioral Health and Prevention Administrator for the Office of Prevention and Wellness for the Ohio Department of Mental Health and Addiction Services. We're also joined by Emily Eckert, who is the Assistant Director for the Office of Whole Child Supports in the Ohio Department of Education, and also by Amity Noltmeyer, the Associate Dean for the Graduate School and Professor of Educational Psychology at Miami University. On the West Coast, we're joined by Erin Wick, who is the Senior Director for Behavioral Health and Student Supports at the Capital Region ESD 113 in Washington State. And we're also joined by Sarah Ellsworth, who is the Regional Administrator for Behavioral Health and Student Supports for the Capital Region ESD 113 in Washington State. I thank each and every person who has joined us today. Our session is going to focus primarily on program evaluation and best practices. We have an esteemed panel here with a variety of latest implementation all the way through to, I believe Ellen might be the oldest program in the United States and also on the best practices list. But we will also be talking about program performance and monitoring examples, as well as making improvements to your student assistance programs. If you can advance, David. So just as a reminder, this is the fifth of a 5-part series. So this is our last and final. And of course, we're focused completely on program evaluation and improvement processes. David, if you'd like to advance. So just a quick note, today's presentation includes 5 short questions in a survey when the meeting closes. And you'll get that survey when the meeting closes to help us really better learn and understand today's webinar participants, kind of where you're coming from and any information you have there. By answering their questions, you agree that you'll have your answer. Your answers will be anonymous and included as totals and percentages. So, Dave. So I just always want to make the reminder, SAMHSA recommends using the strategic prevention planning framework. Nothing magical about it. It's a 5-step strategic planning framework. And there are many paths to really get started to this. The point is really to get started, but depending on your infrastructure, resources, and needs, you'll have to make consideration for a lot of these. And you'll hear a lot of that from all of our panelists today. So next slide, please. Just also as a reminder, so we've talked a lot about the 9 components of effective student assistance programs, everything beginning with school board policy and ending today on program evaluation and improvement. You can find all of this information in the Administrator's Guide for Schools, but any number of the panelists here have a variety of ways that they'll discuss and talk about some of the implementation, in particular on program evaluation and improvement as we go on through today. So with that, David, if you give me the next slide, and I will turn this over to Dr. Michael Dennis to carry us through and give us an overview of the differences between program management and evaluation. Mike? Okay,
thank you. So I wanted to start off with just talking about the difference between program management and evaluation. Typically, when you're managing a program, you're focused on limiting resources to effectively implement and sustain program components that achieve your agency's goals. Now, in a school, that's going to be client-specific, parent-specific, classroom-specific grades, a variety of things. When you talk about program evaluation, your goals are to provide useful feedback about the program to a variety of audiences. Most often, feedback is perceived as useful if it aids in decision-making. So here, the emphasis on multiple stakeholders, which you'll hear about in the examples. And you also see how the feedback leads to potential changes in the program, what's working, what's not. And often there are things in between that are working sort of, but need to be tweaked to get a little bit more optimal outcome. Next slide, please. Some of the common questions, and obviously those two overlap, but they are different in their focus. When you talk about some of the common questions, you're typically looking at questions like who's being served and what are their needs? How are the services triaged or matched to those in need? Who needs suicide prevention? People who are suicidal, at least at the most crisis level. Who needs anger management? Certainly people who are angry. So triage and matching is often a question of appropriateness for the type of intervention. To what extent is a process or intervention being implemented as planned? One of the great lessons of Project Match from many years ago was that mailing out the manuals and letting them sit on a shelf in cellophane doesn't change practice. You have to actually do it. Only with reliable implementation do you achieve reliable outcomes. Increasingly, we're interested in whether or not there's evidence of health disparities, service gaps, or policies that can be addressed to improve implementation. If you're seeing that the kids that you refer who have ADHD are not staying in the program, it may not be a great fit for kids that have impulse issues. If you see, and you may be able to change the program, or you may be able to pick a different program, change how you cope with it. How is the degree of implementation related to outcomes? In the hallmark of evidence-based practices, not just that you've achieved better outcomes than some other group, it's also that you've demonstrated a relationship between your intervention as the causal mechanism and the outcome, that if they don't get it, they're going to have less of a difference than if they get a partial or a full dose. So that's something we often do in evaluation, is not just look at the implementation, but the extent to which better implementation is in fact associated with better outcomes, whatever those outcomes may be. What does the intervention cost to implement is another common question. Rarely does one evaluation do all these questions. These are just the kinds of questions people often ask. Do two or more approaches, which of two or more approaches are more effective or cost effective? Next slide, please. So one of the most fundamental things you do when you're starting out and periodically thereafter is to start off with a needs assessment and approach selection. This is kind of a hallmark of an EPIS model or other implementation science. Got to find a fit between the population you're trying to serve, the problem, and what the needs are. What are the needs of the target? Who is your target population? What are their needs? How are services being targeted by need and severity? We talked about some of these examples. How well targeted are the services provided or planned to the needs of the students? When 20 years ago, when we were doing one of the first cannabis studies with adolescents using evidence-based practice, the original draft of the manuals was all about white males with balding heads. While that may have been appropriate for Rob or I, it wasn't very appropriate for youth in high schools. So we had to get in not only younger people, but a mix of males and females and multiple racial to better fit and reflect the population. The techniques of motivational interviewing, cognitive behavior therapy may have been the same, but the examples also matter. So CBT was talking about problems at work or in your marriage, whereas once it was revised to be more targeted to adolescents, it was talking about getting in trouble in the restroom, about girlfriends and boyfriends, and it was made more appropriate. Even if the techniques were the same, the examples had to be tailored. I mentioned here from the tech staff to everyone, if you have questions, you can interrupt me. I don't think you can actually interrupt me orally, but if you send a message to the chat, Dave will make sure I answer it. Another issue is constraints of policy, funding, staff, school setting to see what's feasible. One of my favorite slides is to show that yes, the effect of a type of evidence-based treatment matters, or prevention practice, but often the implementation matters as much as the type of intervention. And that when you see a weak intervention implemented well has about the same effect as a great intervention implemented badly. Of course, the best thing is to do the graded one implemented well, but you want to see go up as high of an intervention as you can afford to implement well within your constraints. So if somebody tells you, well, you need 2 family therapists to run this session, that's not likely to be feasible in most schools. And they should be PhD, by the way. No, that's not going to happen. So you have to say, well, what intervention matches the kind of staff I have and the kind of resources I have that I can afford to do the best possible job with. Next slide. One of the things that's sort of the hallmark of a lot of more mature evaluations is you see that they start focusing on their process evaluation or their implementation. How well is an approach, process, or intervention being implemented? Can you make a service cascade? So think about this in a prevention setting. You may screen or do something else to identify need, but only a subset of those people may be actually in need of any given service. Of those, you may refer some, but typically not all. And of those you refer, some but not all may start the intervention. That service cascade is kind of nice because unlike a randomized trial, up is good. You want, after the need is identified, you want to see a higher percentage referred and you want to see the people referred a higher percentage starting the services. It's very simple and clean, easy for a principal and a district superintendent to understand. Parents understand it. It makes sense. So service cascades are increasingly common in research. Examining potential reasons for gaps or drop-off. These are not only performance metrics, but what if you see where you're having a problem, it's related to race or gender. Girls don't get referred. Why is that? That shouldn't be, because we subset to the people with the same type of need. So once you subset to the same needs, then it opens up the ability to look at health disparities, also to check for variation. Some of the things you'll be hearing about are systems of prevention that are across a state or a region. And they can look at, is the problem in a particular school or schools where they may need more staff training or resources, or is there a clinical subgroup where that's driving the problem? You can also identify often gaps in the service that are time-based. So if I refer you to a service and everything else is the same, if you can start that service the same day, a week later, a month later, or 3 months later, that time delay is going to drive the rate of successful initiation of the service. The longer you delay, typically the lower your initiation is. So if you find a problem and you go back and you say, oh, in this site where it's taking us back in Washington, sometimes they have rural school districts where the prevention person is only there on, the SAP person's only there on certain days of the week. So they have the challenge of potentially longer gaps before they could start services. You have to identify those things and try to target those strategies. You can also identify misfits of the original materials with the population or context. If you're out on a reservation and you're using things that are from an urban context, it doesn't fit. You have to change your examples and your representation, even if all the techniques are the same. You can examine whether the degree of implementation is related to outcomes to test the presumed causal mechanism. If you think that typically people focus on, did we identify need? But in reality, it's typically the referral and the initiation of a service. It's not whether or not you got them in a prevention class or program. It's whether they actually went and whether they engaged that drives the outcomes. So the more you can fine tune your evaluation to identify the actual causal mechanisms and relate them to outcomes, that typically strengthens an evaluation. Next slide. It is true that comparative or cost effectiveness is often the focus of evidence-based practice registries. They're only of interest when there's uncertainty. If something works, you don't do a randomized trial. If it's working and it's working well. You only, when you're not sure which of two or more things is a better approach, would you want to do a study of effectiveness. Or if they work equally well, but they're very different in cost, or they work differentially well, but they also cost differentially, then you might look at cost effectiveness. No matter what, your question is, they're only of value if the intervention was implemented well and outcomes and cost were reliably measured. Garbage in, garbage out. If you don't implement the intervention well, nothing about the design will fix it. You can compare them on the basis, there are other alternatives, such as comparing them on the basis of change over time, matching, analysis, covariance, needs-based assignment methods like regression discontinuity, and of course, then there's random assignment. And I love doing random assignment. I do random assignment. I just don't want people who are doing real work to think that's the end all, the be all, and the registries sometimes overemphasize it. And it really doesn't make sense, because once you've proven it in an experiment, particularly a couple of experiments, it makes more sense to show that the quality is being maintained and the relationship to outcomes are being maintained, rather than trying to replicate earlier experiments. That really doesn't make sense because they're not uncertain. Cost effectiveness is an odd thing. The economists usually, we often look at multiple outcomes for different subgroups of people and different levels. So in evaluations and prevention, there may be what's going on with the kids, the classroom, the teachers, the parents, the community. There may be multiple levels. And when you talk about cost effectiveness, this only makes sense when you're looking at the cost per the primary outcomes. So if the study has 2 or 3 outcomes, you might get 2 or 3 answers, but you really have to have a match between the cost effectiveness and the clinical primary outcome, or the cost effectiveness is often garbage. Next slide. I believe I'm turning it over at this point.
Thank you so much, Michael. That was really helpful. As most of you know, the building principal support is really an essential factor in the success of a student assistance program. So when planning evaluation, I think it's critical to provide information that will help the principal decide how hard to push for the things we need to make the program effective. Next slide, please. So my suggestion is to give the principal information monthly, at the end of the first semester, and at the end of the school year. And the kinds of things I think are so helpful for principals to know are, how are students coming into the program? Are they being self-referred? Are parents referring them? Are they coming as a result of administrative referrals from teachers or from community members? Many student assistance programs judge their success based on the number of students that self-refer or are referred by peers before their issues become so serious that they come to the attention of school staff. Another important piece of information is for the principal to know the numbers of students that are being seen. Are they being seen individually or in group sessions, or are they being seen with family members? Also, the kind of consultations, the numbers of consultations with other school staff, but also with community providers, including a coalition if a community has one. Referrals for additional services are also a source of essential information. Are students being referred out to private practitioners for mental health or substance use treatment, or to clinics or to inpatient programs? Are they being referred to domestic violence or relationship abuse programs or rape crisis centers? It's important, I think, for the principal to know that you are not the be all and end all as a student assistance program, but that you're part of the continuum of prevention, treatment, and recovery services for mental health and substance use. And then also, last but not least, the school-wide awareness activities. How often and what is the nature of the activities that are being done to change the environment in the school, whether it's Drug Facts Week, the Great American Smokeout, National Children of Addiction Awareness Week, etc. It's so important for the principal to know what's being done. Next slide, please. I mentioned semi-annual and annual monitoring. At the end of the first semester, I think it's really helpful for the student assistance coordinator or team to provide the principal and other administrators with demographics in terms of the students that participated in the program. It's so important to know that your program is meeting the gender, racial, and grade diversity of the building that you're in. Because if you're not seeing the right proportion of males versus females, or Hispanic or Latinx students, it's important to know that you need to make a pivot to involve those students in the way that they're represented in the building. Also, what are the identified issues of the students that are being seen? Are the primary issues drugs? Are the primary issues mental health issues? And if so, which drugs, which mental health issues? Is it bullying? The principal and other administrators also need to know that information. And then in terms of annual monitoring, in addition to the information I've already covered, I think that's where it's important for the principal to know, is this program working? Has there been a change in perceived risk of harm of alcohol, marijuana, prescription drugs, any of the other drugs? For the students that aren't using, have they maintained a no use status? Is it really doing prevention? Also, 30-day use for the students that are using, have they decreased their use, maintain the same level, or increase? And then certainly the things that schools are also concerned about, disciplinary actions, whether they're detentions or suspensions, and then bonding to school. The students that you're seeing, do they get more involved in school, either by going for extra help, joining clubs and activities, attending school-wide events? Next slide, please. With all the things that I just mentioned, there can be challenges. And student assistance programs are multi-component programs, and there are things that you might do that are not covered in the things that I just mentioned. So it's important to figure out which parts of your program are the things that your principal needs to know about. And you may need to expand some of the things that I just mentioned. Also, your workforce. Nationally, there is a workforce issue. There are high rates of turnover in most of the human service fields. So what happens when you have a vacancy? And this was touched on briefly by Michael. How do you report data when the person who's supposed to do that is no longer working for you, or gets sick, or isn't interested in, or isn't accurate in entering their data? And also situations that we have no control over, whether it's COVID-19, natural disasters such as tornadoes or floods or blizzards or fires, which close schools down or really take a lot of your activities out of what you had planned, or other disasters such as school shootings, terrorism, and things that you have no control over. All of these kinds of things can impact your evaluation activities. Last but not least, Michael talked about experimental design and randomization. And while it's not necessary, some states do require it. And some states force student assistance counselors to use a random assignment design. And even if you do that, there can be problems. So just for example, if you decide that you're going to do pre and post tests about 30-day alcohol use, and you're going to do it for all the students that are seen in the school, but the only students that are going to get student assistance services are students with even numbered birthdays, and then you compare even numbered birthday students with odd numbered birthday students, technically that would sound like it's a good random design. Unfortunately, we all know that students are influenced by their friends. So if a student with an even numbered birthday reduces their use, there's a good chance that their best friend who has an odd numbered birthday is also going to reduce their use. So even when you use the highest level of evaluation design, there can be contamination and there can be problems. Next slide, please. And I just want to give an example for a second. Next slide. So just for example, in one component of a student assistance program, we evaluated pre and post perception of risk of harm of alcohol, marijuana, prescription drugs, and binge drinking. And you see from 2018-19 school year to the 2021 school year, so we have 3 years, and the pre-test measures were the first numbers listed in each column, and the post-test measures are the second number listed in each column. And we were really pleased that there were changes, that most of the students who were in the program increase their perception of risk of the drugs that I mentioned, from moderate risk to great risk. Well, we were forced to do experimental design. So this year, we took students that were involved in the program in the first marking period, and we pre-tested and post-tested them. And the numbers you see in the fourth column is just their post-test score in terms of their perception of great risk. And then we had the control students, and those were the students that weren't going to take the program until the second marking period. And what you can see is that the students in what we'll call the control group had lower perceptions of risk of the drugs. So that would lead someone to say, well, the student assistance program really worked, because the students that took the program wound up having higher belief that there was a risk of harm of using drugs than the students who didn't get the program. But what you also see is when it comes to marijuana, you see it wasn't statistically significant. So the advantage of using this evaluation is that it tells us that we need to do more to deal with perception of risk of harm from marijuana use. It was really useful information. Our state just legalized non-medical marijuana, so this becomes our task for the remainder of the school year and into next year. That's all I have. I'm going to turn it over right now to Terry Rosen in Pennsylvania.
All right, thank you, Ellen. It would be the next slide. Yep, thank you. So in Pennsylvania, SAP has been in place for over 30 years, and it's been supported by a long-standing collaboration as well as shared funding between 3 state agencies that oversee our statewide SAP efforts. So you can go to the next slide. I do also want to mention that Pennsylvania is a Commonwealth. So while we do have best practices around our statewide model for SAP, there is local control at the county level, at the district level, and so that certainly has an impact on SAP implementation and our data and evaluation efforts. But really what we do in terms of program evaluation, this is taking place at multiple levels. So we have efforts happening at the team or building level, at the county level, and at a statewide level. And then our statewide network, which is the Pennsylvania Network for Student Assistance Services, has developed a range of measures that can be used at the local level to help support implementation of SAP and fidelity to the model. And we have 10 regional coordinators that are part of our statewide network whose role is to provide technical assistance to teams and support SAP best practice within their regions. So at the team or building level, some of the tools that we have made available are implementation and fidelity checklists that align with our best practice guidelines. We've developed satisfaction surveys that teams can use to gather feedback from staff, from parents, from students about the SAP process and how that went, whether it met their needs. And then we have team member surveys that can be used by members of the SAP team for them to look internally, for them to be able to report on their functioning as a team. And then these data help support teams in identifying their strengths and challenges to improve their local building level efforts, district level efforts, and can also be used to help identify technical assistance and training needs. And then at the county level there, we have what we call SAP County Coordination. And this is a coming together of an organized group of SAP stakeholders in the county. So it's including the school districts, it's including our SAP liaisons who sit on teams and do the screenings, assessments, consultations, and other supports. It's including county, mental health and drug and alcohol leadership, and sometimes other systems partners, juvenile justice or child welfare. So it really varies in terms of who those partners are within a county. And what they do at these meetings is they bring together that local data, whether it's SAP related data or other data related to student behavioral health, wellness, other relevant data that's available to them, and use that for information sharing, for data sharing, to look at needs or gaps in SAP related services, again, to look at training needs, to resolve conflicts, and really to engage in joint planning and problem solving. Sometimes resource development happens from there to promote effective service delivery. And then statewide monitoring is occurring with a few forms that I'll share a little bit more about on the next couple of slides, but we do require reporting from our school entities as well as from our county mental health and drug and alcohol agencies. that fund those SAP liaison services. We also have our SAP regional coordinators that do a monitoring of our state approved SAP training providers to look at fidelity that's coming out through training. And then most recently, we have established an academic partnership with Penn State that they are helping us to evaluate a lot of our trends based on our statewide data over time. So next slide, to share just a bit more about the statewide data reported from schools and agencies. So the data coming in from school teams is reported at the referral level. It's capturing a lot of the elements that were discussed earlier in this presentation. So really looking at things like demographics so that that information can be disaggregated, looking at those referral reasons, the recommendations, and then of course, whether services were accessed. There's also a component that's looking at factors that impacted the referral outcomes. We, as a state network, also have committees that make revisions to these forms based on our review of the data so that we can gather more precise information over time. One thing, for example, that was recently changed in our school reporting forms was to take the behavior referral category and expand that so that we could be able to better capture whether the referral was based on an internalizing concern or an externalizing behavior concern. And then the data coming in from agencies is reported to really reflect the range of SAP liaison activities in terms of what they do to support teams and their efforts there, and then the outcomes for students that they serve. So students that were referred for a mental health and or drug and alcohol screening or assessment, and again, looking at recommended services coming out of those and access to those services. So with the next slide, I just want to share, in the past couple of years, we have begun using infographics to display our annual data in a way that's more easily digestible for our stakeholders. And so these are just snapshots of, on the left, you're seeing the school reported data at the state level, all aggregated there. And then on the right, that is our agency data, that's front and back, but just a snapshot to show all of you. This is from the 2020-2021 school year. So of course, as many SAP services did, I'm sure in other states, we saw decreases in SAP activities across the board, again, coming out of virtual schooling and some of the closures, but still very high numbers of utilization during those times. And as part of our statewide network strategic plan, we are really focused on expanding the use of data for decision-making purposes. So in pushing infographics like this out to the field, one hope is that we're making our data more accessible and hopefully being able to model this to our counties, our agencies, and our teams. And so then on the next slide, through our partnership with Penn State Pro Wellness, our statewide SAP network has been able to delve more into our data to really be able to look at successes and challenges that can help us identify areas for improvement and focus moving forward. And so our partners at Penn State, they did analyses using the school entity reports that I showed, as well as the agency reports that I showed, and they looked at those data over a 5-year period. And so many of the trends that are coming out of this evaluation, such as data on referral sources, which we know are primarily instructional and non-instructional staff, as opposed to parents and youth, looking at things like trends in consent. This data is really reinforcing feedback that we have been receiving from the field for several years that is pointing to the need to continue to build an awareness of SAP among our youth and families, and really to work to reduce stigma to hopefully, again, increase those referrals that are coming from those stakeholders. We also saw consistency in terms of behavior as a primary referral reason coming into SAP, but we did find that there were some disparities that were coming in based on referrals by sex. So males constituted a greater percent of referrals relative to their overall enrollment. And this has pointed to a need for us to look at other sources of data that can help drive referrals. And in fact, this academic partnership that we formed has led to some additional opportunities for SAP to be integrated into other research studies. For example, there's been a randomized controlled trial on universal depression screeners in schools. and using that method of identification to look at impact on SAP referrals and then subsequent access to services and supports. A few other things just to highlight in terms of some emerging areas of focus. There were no racial ethnic disparities found at the point of referral to SAP, but some found at different points in the SAP process. And we also saw an increase in our SAP referrals over that 5-year period, despite a decrease in overall public school enrollment. So we're really looking at, these trends in utilization of SAP, these increasing trends in mental health concerns, and just wanting to use that to help strengthen fidelity to our SAP model, which has led to us looking at an extensive training revision process underway. So really this partnership has helped us to be able to delve more deeply into our data and these trends that hadn't previously emerged. Our partners have helped us to look at that and then also be able to use this information as an advocacy tool to support SAP in Pennsylvania. So just with the next slide, I just wanted to share our main website for the Pennsylvania Network for Student Assistance Services. This is where all of our resources are housed, as well as contact information. And I've just also pulled out a couple of specific data and evaluation resources highlighted here. So I will now hand things off to Valerie.
Thank you so much, Perry. So in Ohio, you can go to the next slide, please. We're in our early stages of the Ohio School Wellness Initiative, where that consists of our Student Assistance Program pilot and also a Staff Wellness Framework pilot for schools. So there's really two aspects of evaluation that we're coming from because of where we are in the process. We have the overall evaluation with Miami University of our process and how all of this is coming together and working with our pilot schools, but then also really developing pilot schools' capacity to evaluate and improve their own student assistance programs. So starting off, it was really important for us to set a clear goal around program evaluation and really help schools understand that planning for evaluation and sustainability and their innovative practices is critical and needs to be ongoing. And developing ways to help them get through some of those obstacles that schools often face with evaluation and just really be of support to them as they move through this process. Next slide, please. So within the initiative, we've been working on a lot of materials to really support our pilot schools' capacity to engage in their program evaluation efforts. So for example, program evaluation has been incorporated into our manual that's being developed, specific trainings and other resources. Currently, we're working to develop a more comprehensive specific program evaluation toolkit. So in this work, we're really looking at these 4 different phases of evaluation that you see on the slide, an improvement process. So we start out with the student assistance team, working with them and encouraging them to plan for the evaluation by identifying those goals, questions, measures, and plans. Then we're helping them and that team implement the evaluation procedures, and then really encouraging them to share their results with relevant partners and stakeholders, including families and the students. So it's really important to use those results to identify and implement program improvements ongoing. So we really try to emphasize that this isn't just a one-time thing. Evaluation needs to be an ongoing process and part of everything that you do within your student assistance program. And with that, I'm going to pass it over to my colleague, Emily Eckert.
Hi. Earlier this school year, the student assistance team at each one of the pilot schools that Valerie mentioned, each of those teams was asked to complete a student assistance program fidelity checklist to identify their current level of implementation of various aspects of their student assistance programming. On this checklist, we included items on 10 different domains of best practices, and program evaluation was one of those domains. The program evaluation items included those shown on the left side here. So you'll see reviewing and evaluating processes and procedures, satisfaction and stakeholder input and information and input from administration, staff, students, parents, and community members. Of the schools that submitted fidelity data, we found that the mean implementation score on the program evaluation scale was the lowest mean of all 10 categories. However, it was the 5th highest mean score when schools were asked to rate how much of a priority each of the 10 domains were moving forward in their work. So this suggests that although implementation has room for improvement, Ohio schools are interested in developing and implementing better and improved program evaluation processes. On the right side here, you'll see the self-assessment checklist. And this shows an example of how schools were asked in an action planning tool to identify areas of strength, improvement, and priorities for program evaluation. Now I'll turn it over to Amity.
Thank you. So on this slide, I'd like to dig a little deeper into how we're encouraging schools to think about program evaluation in the Ohio School Wellness Initiative. So, Valerie mentioned the 4 phases of program evaluation, and this slide focuses on the plan and implementation phases. So we recommend developing a clear evaluation plan from the very beginning of your SAP work. And this plan should really be developed around a set of questions that you want to answer. And this was mentioned earlier by Michael, and I think also by Valerie. We've included some possible questions at the bottom of this slide. And as you remember, there was a slide earlier that had some additional questions you could think about. And then to answer your questions that you've identified, it's important to think about both process variables and outcome variables, which was also mentioned earlier. So with the Ohio School Wellness Initiative related to our process data, many of our schools are collecting data, as Emily mentioned, on fidelity of implementation. They're engaging in process-oriented discussions within their student assistance teams and with others. They're completing monthly school feedback forms that include questions about process. And some are collecting survey data on satisfaction with student assistance program services. And by the way, I will definitely tell Perry that the Pennsylvania resources are very helpful, and a lot of the tools that we've developed have been based on this. So I'd highly recommend checking those out. Related to outcome data, some of our pilot schools are looking at data on mental health screening indicators, restraint and seclusion, discipline, substance use, and referrals. So for example, one school that we heard from recently began working with their guidance staff and school navigator to track the percentage of students referred to outside mental health services. So there's a lot of different things going on, but as Valerie mentioned, we're early in the process, and these are just some examples. And finally, it's important just to obtain important information from diverse stakeholders using multiple methods of data collection. So for example, the surveys that I mentioned assess satisfaction from family, student, and staff perspectives. Next slide, please. Great, thank you. Oh, I'm having a little problem here on my computer. Sorry about that. I can't see the screen all of a sudden. There we go. Okay. So as Valerie mentioned earlier, we are just at the beginning of our work. The Ohio School Wellness Initiative just kicked off in January 2021. But many of the participating schools, we have 70 plus schools participating, really didn't begin their implementation until August. So because of that, we don't have as many examples as some of these more established programs about how our schools are using summative outcome data right now. But we are encouraging schools to use data throughout the process to inform improvements on an ongoing basis. So for example, one of our pilot schools recently shared a story about how their team reviewed data and used it to inform a staffing change that allowed more time for home visits and follow-ups is one example. Another example of using data to inform services through our project over the next 3 months, regional needs assessment reports are going to be shared with individual regional team meetings, and there'll be time built into those meetings to really discuss and plan how those results can be used to inform implementation to better support the needs in those regional communities. The Ohio School Wellness Initiative also offers the opportunity for regional teams and networks to discuss implementation and outcomes with the intent of improving practices at the school level, and also allowing us to better tailor the training and technical assistance resources to the current needs. So I am now going to pass it off to the colleagues in Washington.
Hi, thank you. And in the interest of time and making sure we have time for questions and answers, I will be speaking on behalf of Washington. If we can move on to the next slide. And much of what we have to share, I'm really just going to be reinforcing and highlighting what my colleagues have also shared. So I will try and get through this as quickly as possible. But when we talk about the intention of program evaluation and improvement within our regional educational service district, those things that we're intending to do is monitor the effectiveness and quality of our programs, ensure compliance with state and federal regulations, identify service gaps and program improvements, and informed training and education for our staff. If we can move on to the next slide. So one of the measures that we use to evaluate across the state, not just within our ESD, the effectiveness of student assistance programming at the student level is through a pre-post test. I believe Ellen spoke about this, and this is one of our annual evaluation efforts. This is an example of what the Washington State student pre-post test looks like. So students take this at the initiation of intervention, and then at discontinuation of intervention to gauge outcomes. And if you can move on to the next slide. These are examples of reports that we look at on a consistent basis, at least monthly, but along the timeframes that several others, so monthly, quarterly, annually, and then over the course of time to compare years to one another. And when we talk about a tiered model, which most of our student assistance professional services are, you can see that we're evaluating what's happening both at tier 1 and in tier 2. So those universal activity reports are what have our staff done that reaches all students? What messages are they sending? Who have they reached? This includes staff presentations, parent presentations, student presentations. But that's really the what, because what we know with prevention is we often can't prove what didn't happen. And so we really count activities. And then those indicated student reports are really what are the outcomes data for students who engage in our tier 2 or intervention services. So we can see again, what services just basically did they get? What progress did they make? What were their long-term outcomes? Did we impact their substance use as we intended? Things like that. And one of the most important pieces that we look at very consistently is the data to monitoring reports, because one of the biggest pieces of our evaluation is to ensure that we have quality data going into our system. So we have quality data that we're looking at. And so this is something that we provide at the staff level feedback about on a monthly basis. So are there gaps in your data that means that we're not going to be able to trust the outcomes that we get? Is there good quality data that's happening? Are there things that you're not capturing? Those kinds of information to get back to them so that we can trust when we look at the outcomes data, it's as meaningful as possible. Next slide, please. And so when we do this, this is just a snapshot of some of the outcomes that we look at and we share back with our stakeholders consistently. These are 5-year averages. Like many people, we really grappled with how do we make meaningful sense of our COVID data. One, because we know we were serving far fewer students because students weren't in school, our referral structures were impacted. And also, how do we make the case that what we were doing before COVID is likely to be effective post-COVID? And so we really have been looking at what are our average outcomes over the past 5 years. And so of students engaged in our program, which is specifically focused on substance use prevention and intervention, we saw an average 5-year reduction of alcohol use of 37%, 44% reduction in binge drinking, and an average 41% reduction in marijuana use. We also saw a decrease in problem behaviors, including a reduction in school suspensions and a reduction in arrests. And if you go to the next slide, we also, I think we've talked about this in several of the other webinars, and Ellen did a really great job saying principals are really important gatekeepers. And what we know is our schools are often interested in and care about our behavioral health outcomes, but they're also highly invested in what are the academic outcomes and how are these students going to do better in school. And so that's a big piece of our evaluation as well, is sharing with them that students who receive prevention and intervention services are students who show up ready to learn. And so what we see is an average of 39% of participants said they were more likely to attend school because of SAP services. In context of the way we ask this question, that's a pretty significant increase, because something around 40% are already attending regularly. So 39%, that means of students who are engaged in our services, about 80% of them are now coming to school regularly, 39% of them who have increased their attendance, which is significant if you're interested in academics. And then something that we're also very proud of, and we focus a lot with our staff and prioritizing engaging models of service, motivational interviewing, I've heard mentioned, and cognitive behavioral therapy, is an average of 92% of the students we serve said that they were glad that they participated in their student assistance services and those services were meaningful to them. Next slide. And then just to summarize again, how we use the data that we get to improve our program. One is, how do we develop and improve our outreach efforts? Who doesn't know about our services that should have? Who's not referring to our program that should be referring to our program? What students are we not reaching that we should be reaching? And how do we target that outreach to them? Again, that monitoring of data collection, are we getting quality data into our system to have meaningful data coming out of it? And then that consistency of sharing program outcomes with our stakeholders, making sure our schools know what's happening for students in their building, making sure our funders are aware of the progress and changes students are making, sharing it internally with our teams that what they're doing makes a difference, promote staff training and education. So where are the gaps? Where do we need to strengthen skills for our staff? What sort of models do we want to use? And then how do we identify evidence-based practices that meet the needs of the students that we're seeing? And I think that is it for us. And Rob, I will hand it back to you.
I just want to say thank you to all of our panelists today for really helping to paint the broadest picture of student assistance services you could imagine. We've got very mature programs here who have been evolving and tweaking and evaluating for decades, and implementing, to the newest programs who have been able to benefit and stand on the shoulders and grow from that. And all of that is very exciting work. I'd like to open it up for questions at this point in time. So please feel free to ask any of the panelists questions. And if we don't get to them, all of your questions today, given time constraints, please feel free to email and we'll make sure and get those questions answered. So with that, let me open it up. And Dave, do we have a question here?
Right now, Rob, I do not see any coming into the Q&A box. If you have a question, please add that to the Q&A box.
And while people are formulating their thoughts, and you know, there's just a few things that really do come to mind. I think one of the things that I've often said is, you know, good intentions don't always equal good outcomes. And I hope what everybody walks away from today is that, as Mike started with sort of the overview and the landscape of, so what does evaluation look like, and some of the differences between program management, monitoring, and evaluation, two different things, right? Some of the limitations and pitfalls. Ellen did an excellent job of, okay, so you think it's one thing when it may not be exactly what you think, and how you might want to consider that. What seems to be a nice outcome, maybe not been the outcome that you were actually looking for, in a different way. But also that continuous improvement and continuous evolution is actually required in all of these services. Every year it changes, the landscape, we get new children into the schools, the environments change. Many of you might be quite aware that the policy environment has changed as Washington State and other states have relaxed policies on marijuana, cannabis, and other sort of substances that way in many different ways. All of that has an impact. Schools are a representation of the children of that community. And I think you heard from some of our colleagues today that it's important to make sure your services reflect that. That if we want good services and we're looking through our data, and you really wouldn't know that unless you were looking at your data and paying attention to it. And I've yet to date to ever have known an educator that wasn't interested in the success of their children. Everybody I know that shows up in a schoolhouse is looking to serve those children well, and make sure that they get the best education they can do. And of course, that's very difficult if you're a child that's not available for that educator's good instruction. And that really is the job of student assistance broadly. So I'll take another moment to see if we get any questions, and it doesn't look like we do. Let me just open it up to the panel if there's any final comments as we're getting close on time.
I would just share the importance of having, you know, everyone working within your system, understanding the evaluation plan, what their goals are for the project. And then when the evaluation is completed on the project, really having a thorough communication process out for partners and community and all those types of things, right? To really show the power of what we're doing. So a lot of times I think that one of the things that doesn't happen is the staff don't know what the evaluation plan is. And so they're out there doing their work, but really sometimes helping them connect those dots and understanding what it is that we're working towards is important.
I think a big lesson that we've learned with evaluation this year as well, and I know we've talked about it as panelists, but the importance of having that regularly and consistently scheduled opportunity to share data. We learned some very important lessons about how to re-engage services post-COVID. And we tried to tread really lightly at the beginning of the school year because our schools were really tasked, our administrators were spread quite thin with figuring out how do we do testing protocols, how do we do masking, how do we do these types of things, while we also had significant administrator turnover. And so really being very proactive early on, walking in and sharing, here's historically what's been happening in your building. Here's what the outcomes, here's the benefit to the students. Here's why it's important for you to continue these services, and to do that each and every year, no matter how long you've been in that building, no matter how long those relationships have been sustained, but just reaffirming over time the importance of these services.
I just want to also add to what Erin said about the importance involving staff and evaluation and getting their buy-in. One of the ways we do that is we require our student assistance program staff to actually meet with the principal to go over those monthly statistical reports so they can have a discussion and put a face on it so they're not just numbers.
And one more thing that's actually come up in Pennsylvania, especially through our academic partnership, has really been in thinking about the tools that we're using to gather our data. Really, the data that we have on our outcomes is only as good as those tools. So in partnering and getting a research perspective on the data we're gathering, it's really also opened up some doors for us to revisit, you know, the tools that we're using at the statewide level to gather that data in the first place and look at where we can improve on those.
I wondered in the few minutes remaining, you know, we often talk a lot about workforce, and we've certainly sort of hinted at it here. It's very clear that both educators are sort of leaving the educational system, so we're having drain there, but it's also true in the behavioral health space. But one of the things I might just ask, if each of you might want to comment, the kinds of people that you're actually looking for to do this work, because my experience has been it's not always as self-evident as one might think it to be in this. You could be a great clinician and not be very good in a school, and vice versa, if you will.
I'll start. We look for people with a master's degree in either social work or mental health counseling that ideally have experience in substance use prevention or treatment, but don't want to just sit in their office and be a clinician. They want to do bulletin boards and meet with groups of students. They want to speak to parents. They want to go into the cafeteria and say, how was your weekend? How are things going? So we really need people that are willing to, what we say, change their day. So it's 70% what would be considered clinical, 30% non-clinical, outreach, meetings, creative school-wide awareness activities. And not everyone wants to do that.
I would chime in that in Pennsylvania, our model is really multidisciplinary. And so, we have teachers that sit on SAP teams. We also have, other school professionals, as well as those SAP liaisons from the community that bring that community expertise in terms of local resources or mental health, drug and alcohol expertise. And then we have all of that supported by our trainers and our regional coordinators who bring that working knowledge of our SAP model. So I think, a strength for us is just kind of that multidisciplinary piece. Some are more equipped and have the relationships with the students and families to get their buy-in, whereas others have the expertise, in mental health or drug and alcohol. And it's really a lot of that collaboration that really helps make our model work.
of the things I think we found is the intangible pieces that are hard to train. We have a lot of confidence in our ability to train staff in substance use specifics, but the intangibles that are invaluable are the ability to be flexible. We've had a lot of really great clinicians come into our program who are used to sitting in an office and seeing a client every hour on the hour and having 10 minutes for notes. And that's not what a school day looks like. And those people end up not lasting very long because their expectations are very different than the reality. So flexibility, and we ask questions that try and highlight that. Also the ability to connect with both adults and students, which is a unique skill set. So to be a very professional, well-spoken, adult when dealing with school staff, and being able to be very engaging and able to build rapport with students, and speak dual languages. So being able to speak the language of a school while also being able to speak the language of an adolescent is a unique skill set. But I think we've really started to prioritize over the last several years intangibles and trust the process of training them on the specifics of the job.
With that, I would like to thank everybody that's attended today. There are a few resources I just want to flash and dash through. So the Student Assistance Guide for School Administrators is available for download both in print. If you want to keep advancing day, that'll be great. We've got some resources around the national media campaign, and I say the media campaign, the national campaign, Talk They Hear You, which really is for a variety of things here, but this is particular for our school folks. And if you want to keep moving on, David, that would be great. There is a 9-minute discussion starter that we've developed that may be useful to some folks. It really helps schools understand the rationale of why you might want to do this kind of work, why you might want to replicate what Pennsylvania or Washington or New York or other folks are doing. And then again, all 5 of the webinars are actually recorded, including this one today, and are available for people to review. So you can always go back and do that. And with that, I would like to thank all of the panelists who've taken this journey with us, provided great information to the coalitions and the individuals. Each of you in your own right are really the testimony to this great work. And I would just thank you kindly and greatly for all of that. And for that, I think our children stand better. So, and that really is the goal of everybody I've ever known to do this work. And with that, I'd like to thank you. You can find us on social media. We're in all the usual spots. Please feel free to reach out as one would like and one would like to engage. With that, I will conclude today's webinar and thank each of our participants.